Some women have inverted nipples, and the first time they actually find out about this is when they're seeing their maternity care provider for the first time. They just think that that's them and it's their shape, and they're really quite surprised to find out that potentially there could be problems with attachment and breastfeeding. Just because you've got inverted nipples doesn't mean that you won't be able to breastfeed your baby, but it may be a little bit more challenging than what it would be otherwise. It's important to get whatever advice you can in the early stages, and in fact during pregnancy there are devices which can be used to help evert the nipples. The issue with inverted nipples is that it can become a problem because there's just not enough nipple or tissue for the baby to attach to, and the nipple needs to go far enough into the baby's mouth to elicit a sucking response. It can be useful to use a nipple protector to help try and evert the nipple so that there's more for the baby to latch onto. Look at what's available and see what's right for you. It's important to check how your baby is attaching. Is their mouth as wide open as it should be? Is their tongue underneath your nipple? Have they got as much of their nipple and areola in their mouth as possible? A well-attached baby is less likely to traumatise its mother's nipples. Depending on the individual breastfeeding mother, it can be useful to use either a heat or cooling pad, whichever is right. They can help with engorgement and just generally reducing the discomfort of breast tenderness. Breast shields can be very useful to collect excess breast milk and also increase airflow. There may be times where you actually need to stop breastfeeding for a short period of time, 12, 24 or even perhaps 48 hours, to allow your nipples some time to rest and recover. If your nipples are too tender and sore for you to actually directly breastfeed your baby and you're having a period of time where you're not going to be breastfeeding at all, it's very important that you maintain your supply. The only other option if your baby's not breastfeeding directly is to express.